You've definitely seen the headlines. You've heard the names, right? Ozempic, Wegovy, Mounjaro. These drugs are absolutely everywhere, and they're being called miracles for everything from weight loss to diabetes. But, beyond all that buzz, there's a much, much bigger story unfolding. So we're going to go way past the headlines. We're getting into the real science, the risks, and the brand new rules for what might just be one of the biggest medical revolutions of our lifetime. Let's get into the full story. So here's our roadmap for today. First, we'll break down how these drugs actually work. Then we'll get into all the surprising benefits they have beyond what they were made for. From there, we have to talk about a really critical safety risk that's changing medical guidelines as we speak. That leads us to the new rules for patients. And finally, we're going to sift through the noise and separate fact from fear on some of those other side effects you've probably heard about. Okay, so to really get a handle on the whole conversation around these drugs, we've got to start with the absolute fundamentals. What are they actually doing inside your body? At their very core, these drugs are what's known as GLP-1 receptor agonists. Now, I know that sounds super complex, but the idea behind it is actually pretty simple. They're mimics. They're basically copycats of a natural hormone our gut already produces called GLP-1. And that hormone is kind of a master regulator for our whole metabolism. So these drugs are essentially just turning up the volume on a system our body already has in place. And the way they work is kind of like a four-part harmony. First, they signal the pancreas to release insulin right when your blood sugar is high. Second, they tell your liver, hey, hold on, stop dumping all that extra sugar into the bloodstream. Third, they slow down how quickly your stomach empties, which is a huge deal because it makes you feel full for way longer. And fourth, they work directly on your brain to dial down those hunger signals. It's this incredible multi-pronged attack that just retunes the body's entire energy management system. Now, these drugs were first created just for diabetes, but their mission has expanded dramatically. Researchers are uncovering this whole suite of other really powerful health benefits. And this right here is the bigger picture. We've gone from a simple diabetes drug to what you could call a cardiometabolic powerhouse. I mean, think about it. Beyond just blood sugar and weight loss, major clinical trials are now showing that GLP-1 agonists can seriously reduce the risk of heart attacks and strokes. They also protect the kidneys, and they're showing real promise in treating fatty liver disease. This is a total paradigm shift because they don't just treat one symptom, they're addressing a whole cluster of interconnected health conditions all at once. But with great power comes the need for great caution, right? The very mechanism that makes these drugs so incredibly effective also introduces a very specific and serious risk, especially for patients who might need surgery or other medical procedures. This quote from ANZCA really highlights the core danger, pulmonary aspiration. It's when stomach contents get into the lungs. Now, that's always a risk during anesthesia, but these drugs have put it front and center. It is rare, but the consequences can be absolutely devastating. And that's why medical societies all over the world are taking it so serious. So, here's the crucial point. Remember that third mechanism we talked about, slowing down digestion? Well, that's the key. It works so well that even after a patient does the standard fasting for 8 or 12 hours before a procedure, their stomach might still have food and liquid in it. And for an anesthesiologist, believe me, an unexpectedly full stomach is a major red flag. And the data really backs this up. As you can see here, one study found that patients on these drugs were over 4 times more likely to have food left in their stomach during a procedure compared to people not taking them. That's a significant jump in risk that you just can't ignore. So this all leads to a really critical question for literally millions of patients and their doctors. What do we do about it? How are the rules of the game changing to keep people safe? Okay, so with this aspiration risk now in sharp focus, the way we use these medications is definitely evolving. This is all about setting up new rules of engagement for both patients and doctors to make sure everyone stays safe and has success. Let's start with surgery because this is a big one. The latest guidance represents a major shift. The recommendation is now not to stop the medication. It used to be the opposite. But stopping can really destabilize blood sugar or weight management. So instead, the new protocol is to follow a 24-hour clear fluid diet the day before the procedure. This is designed to give the stomach the absolute maximum time possible to empty, lowering the risk without messing up the treatment. And this way of thinking is maybe the most important takeaway of all. These are not short-term fixes. Diabetes and obesity, they're chronic conditions. It's just like high blood pressure. You don't just stop the medicine once it's working. The treatment is what keeps it working. And if you need proof, just look at the data on what happens when people stop treatment. It's pretty stark. Studies show patients regain about 2/3, that's 66%, of the weight they lost within just 1 year of stopping. And that isn't a failure of the patient, it's a reflection of the chronic biology these drugs are designed to manage. They only work when you take them. All right, so now that we've covered the practical guidelines for that really key risk, let's tackle a couple of the other major concerns you might have heard about and try to separate the clinical evidence from some of the noise out there. First up, thyroid cancer. This concern popped up from some early studies in rodents, and it even led to a black box warning from the FDA. But more recent large-scale studies in humans have found something fascinating. The risk was only higher in the first year of use. This strongly suggests it's not the drug causing cancer. Instead, it points to something called detection bias. Basically, patients starting a new intensive therapy just get more checkups. And all this extra screening is leading to doctors finding tiny, pre-existing thyroid cancers that might have otherwise gone completely unnoticed for years. Okay, the other major concern has been reports linking these drugs to suicidal thoughts. This is incredibly serious, and regulators are rightly investigating. But when researchers have analyzed the data from huge clinical trials and massive real-world health databases, they haven't found a causal link. In fact, some studies even suggest that certain GLP-1s are associated with a lower risk compared to other weight loss drugs. So while every individual report is taken seriously, the highest quality evidence we have to date just does not support a direct connection. So, where does that leave us? Well, we have a true medical revolution on our hands, but it's one that comes with a whole new set of rules for patients, for doctors, and for our healthcare systems. These drugs are incredibly powerful tools for chronic disease, not temporary solutions. And the biggest question we face now is, are we truly prepared to embrace them for what they are, a long-term journey?